Good afternoon, everyone. I am Dr. Siddharth Shah, joint replacement surgeon at SL Raheja, a Fortis Associate Hospital in Mahim. Every year, 12th October is celebrated as World Arthritis Day to increase awareness about arthritic conditions and their treatment. This World Arthritis Day, I will talk to you all about joint replacement surgery in COVID-19 era. We are living in these difficult times of COVID-19 pandemic. In order to control the spread of the virus, a national lockdown had been declared on 25th March this year. When the lockdown was declared, all planned or elective operations were postponed. Only emergency operations were being performed. As a result, most joint replacement surgeries were cancelled and postponed. Now it has been more than 6 months since the lockdown, and we are in Unlock 5.0. But we know that this pandemic may go on for a while. In fact, many experts have even said that we may have to learn to live with the virus. In such a situation, is it wise to keep delaying your joint replacement surgery? So let us address this issue in a systematic way. What is the harm if one keeps delaying surgery for too long? First, the pain and arthritis will continue to worsen, which means the requirement for painkiller medicines may increase. Now, painkiller medicines have side effects. Some painkillers can increase the risk of kidney injury, peptic ulcers, or even heart attack. Hence, one must not consume painkiller medicines for too long. Secondly, with continued arthritis, the muscles around the joint can become weak. This can significantly impair a person's mobility and also delay recovery after surgery. With continued arthritis, the deformity, which is the change in shape of the legs, also becomes worse. Now, this can make the surgery complex and also increase the risk of complications. A person may not get the desired benefit after operation if they have waited for too long. Patients who have long-standing arthritis are also at an increased risk of fractures of bones around the arthritic joint. And lastly, if a patient has arthritis for a long time in one joint, it can result in problems with other joints of the body due to abnormal loading. For example, somebody who has long-standing knee arthritis can start having back pain or hip pain. In the same way, somebody with long-standing hip arthritis can start getting pain in the knee or in the back. Hence, it is not advisable to keep postponing surgery for a long time. Now, patients are concerned that getting surgery done in these times might increase their risk of catching coronavirus infection from the hospital. Let me assure you that we are taking all precautions to prevent coronavirus infection in healthcare settings. We observe globally recommended guidelines to prevent so. Apart from the usual things like thermal screening, regulating the number of visitors to the hospital, masks, and hand hygiene, special precautions like a separate access, separate lifts, separate OPDs, separate operation theatres, separate wards, and even separate staff is kept for COVID and non COVID patients. As a result, a non COVID patient getting exposed to COVID is extremely low. Apart from that, we also take certain surgery specific measures like I perform enhanced recovery or fast track joint replacement, which means patients are able to get up and walk on the same day after surgery and are able to go home within 2 or 3 days following surgery. This means that the duration of stay in the hospital is significantly reduced, which reduces their risk of catching infection. Apart from that, if a patient does not want to come to the hospital after discharge for getting the stitches removed, I perform stitchless surgery where instead of staplers, a special skin glue is used, which means that the patient need not come back for getting the staplers removed. Also, with our modern techniques of surgery, the requirement for physiotherapy after surgery is also minimal. In fact, patients just have to perform some simple exercises which are taught to them in the hospital, and they can perform them on their own without the need of a physiotherapist. So, as you can see that we are taking several measures to ensure that the risk of catching coronavirus infection is nearly eliminated. On the other hand, if you keep delaying surgery, the harm that can come by is too much. So I advise that patients do not delay their surgery for too long as all precautions are being taken to ensure their safety and well-being. With this, I conclude my talk. Thank you very much for listening. Stay safe and take care.